I'm happy to introduce Mr. Knut Mager. It has been a long day now and it's time to somehow wrap up. And to wrap up is also good to have a common denominator, and common denominator is data privacy, which comes with all these issues what we have discussed today. And that's why I'm extremely pleased that we have with us a leading expert in data privacy, head of Novartis global data privacy. And Knut has been also active in FBR by chairing data protection working group since 2019. So this is what we can say first live presentation today, apart from the panel discussion. So Knut, the floor is yours. Please. We are happy to hear your comments.
Thank you very much, Janos. And Joseph, I mean, he put the ambition out there that I would synthesize and summarize the day. It was a long and inspiring day, so I will not attempt to summarize it all. But I would like to build on some thoughts and maybe emphasize some. And I will do this under the theme of sharing is caring. And we were asked to dare to share, and we learned how to prepare to share. And in this theme, I will share my thoughts. So what we've seen today are many innovative, promising, really exciting use cases, initiative and best practices across Europe and really often across boundaries, and I think this is really stunning and encouraging. So what's building here are really maybe not a common data space, but it's several small data spaces. And what we've heard is the need for integration, for really creating this data space. And I think we all feel the sense of urgency now. Now, as you've said, Janos, you called it common denominator. I think one theme that we heard starting also from the very first keynote by Thomas Steffen was a reflection on the role of GDPR and the fact that GDPR does not provide harmonization in the case of health data. And that's really by design of GDPR, because there's the room for derogation by member states when it comes to health data. And we may regret that, but it's just a reality that we need to live with. And we need to address it now and create a harmonized framework. And I will come back to that. So, one other regulatory complication that I think we need to keep in mind is not only that GDPR does not harmonize in the case of health data, but it also fails to provide clarity in its relation to other regulations. So I think it was Ralf Kindervater who made the point that the health space is complex and complicated and often are not sufficiently understood by legislators. And I think it's our role as participants in the health space to explain to legislators. So what we have is a complex coexistence of regulation relating to data, but also relating to clinical research, product safety. And we have different regulators, so the health authorities, data protection authorities, ethics committees, who all play a very important, essential role in regulating the space. Now, in practice, they often disagree on some of the interpretations of the various regulations and how they fit together. And here we need to create clarity if we want to create a common health data space. And this is not about deregulation, it's really just about clarity and regulation. Now, Janos, where I would disagree is that this is the common denominator. I think that we have several aspects that we need to consider, and regulation is only one. And what I found encouraging today is really the notion that we can create innovative solutions and create quality data that we share in a privacy-preserving way. So in a sense, we are already addressing the need of privacy in many of the initiatives. Still, we need to harmonize and we need to coordinate, but we also need to address infrastructure. We need to address, as we've heard, data governance, interoperability, the application of fair data principles, for example. We need to work on capabilities in data digitization across all sectors, regulators, industry, academia, healthcare providers need to embrace digitization, and we need, as societies, build those capabilities in Europe. And then we need to work from a common sense of purpose and urgency. And here I would like to build on some themes that I found really impressive or that resonated with me. So the ingredients and that Ralf Kindervater described when he then later spoke about the many cooks that are in the kitchen and the need to create a common recipe book. I agree on the menu first and create a common recipe books, and you mentioned the ingredients that are required then to work in the kitchen together. And Adriana Maggi, her metaphor relating to the Rosetta Stone really resonated with me, because often we don't have a common language, not only because we speak different languages in Europe, but also across functions, faculties that work in the health space. We speak different languages and we need really to learn to understand each other. But more importantly, as she emphasized, we need a willingness to engage with each other. And here, some panelists also emphasized the need to consider perspective. I think Sebastian Merkel said it very well. So it's the perspective with which you approach the conundrum of health data sharing. So we approach it from the health sector, from medical profession. But then, of course, we need to consider, and many panelists emphasized that we need to consider the perspective of the patient. We need to consider the perspectives of healthy citizens who want to take prevention into their own hands. We need to think about the perspective of next generation patients, so our children who need to participate in health innovation and need to build on the data that we create now. And we need to consider the interests of everyone contributing to the health sector. And we need to do this respecting and being willing to build on ideas of others, so that we don't create within all these initiatives so new silos. But we need to find a way to integrate and really step by step learn, build the system. And here I was reflecting on the contribution relating to trust. That trust is built in a contextual way. So you can trust your doctor more easily, and you may trust your regional context. Maybe this is why many of the cross-border activities that we've seen are really regional. And I wonder whether there's a blueprint on how to really build on the regional activities and leveraging them up, as opposed to trying to create something top-down, or maybe we need to have both. So we need to start somewhere. And here I'm encouraged by the German presidencies, their call to creating a code of conduct, because creating a code of conduct, that's not a co-regulation, but it's really the result of extensive stakeholder engagement. Also, so we will have to engage all parts of society, so and considering the different perspectives. So learn to have this, find the Rosetta Stone, learn to have the common language, and with the willingness to engage. So that's, I believe, is a very good start. Another start is this very conference, where my hope is that it, and my wish is that it really results, it's condensed in the declaration. And then I think we all heard the invitation by Thomas Steffen that then we can hand over the declaration to the German presidency so that it forms part of the inputs of the health data conference on November 11 under the presidency of the German health minister. So with that, I really have big hopes. I thought it was an exciting day. And Janos, I think you brought great speakers together, and we move forward in sort of engaging around this theme of sharing is caring. Thank you very much.